All right, welcome everyone. My name is Cassandra Farrugia. You're welcome to call me Cass. I am NAMI New York State's Associate Director of Communications and Outreach. And you will see that my co-host is my dog Odie, so don't mind him when he pops up into the screen. And as part of our July campaign, we are raising BIPOC, Black, Indigenous, people of color, mental health awareness. And, we're honoring Bebe More Campbell's legacy as, being a mental health advocate. And that was known as Minority Mental Health Awareness Month. So as we keep learning and changing language, we're working to do the same here. And, the different topics and communities we will be discussing today, right, have many different names and many different ways people like to identify depending on where they're from and how they identify with language and pronouns and thinking about the different languages that exist between these different communities. So just keeping all that in mind, we'll do the best we can today, right, to respect this space and respect what our speakers are going to share and value the time that they took out to be here today. I will be moderating the conversation, and please use the chat if you have any questions, and I will share them with the panel. Who will introduce themselves in a minute. I'm just letting a few more people in. So if you are looking to ask a question, please don't unmute yourself and ask the question. Please put it in the chat. If there's time at the end, I will open up the floor for questions and comments. So we'll see how our discussion goes today. So today's topic, right, is Latinx, Latine mental health. And I'm really grateful for all the great people who decided to come on and share with us today. So let's go around and have each of them introduce themselves. So I am going to start with Angela.
Hello, good afternoon, everyone. My name is Angela Colon-Rentas. I'm from Rochester, New York. Monroe County. I am a youth peer specialist, a professional youth peer specialist, bilingual, very few in my field, in this field. And I'm also an artist, as you guys can see up there, probably, that's actually mirror written. So that's why you can actually see it and read it. But I try to focus on mental health, expanding the resources in communication, and also use my art as a mental health coping skill. That's about it for now.
All right, thanks so much for joining us today. All right, and next we have Hilda.
Greetings, everyone, and thank you for joining us here in this forum. My name is Hilda Flores. I belong to the one of the New York State NAMI affiliates. I'm a resident of New York City. My exploration in NAMI was related to different variations of mental illness within my family and also personal. Because of my work in the hospitality industry, I have lived in New York. I was born and raised in Puerto Rico as well, came here for college. Then my career grew in California and then back in New York. So, that I have a personal interest in advocating and educating the Hispanic community. We share the same language, but our life experiences, although yet similar or different, also are completely different from our mental compass in relation to the things we don't talk about. And I am committed to make that change in my own backyard with the Hispanic community. I recently completed a course in family-to-family support. I will be I will be teaching my first class in September. And I hope it's the first of many more, not only for New York City or New York State, but in my island as well. A lot is going on there, and we need people to support those efforts for everyone. Thank you.
All right, thank you, Hilda. And next, we're gonna have Bass introduce himself.
Hi, good afternoon, everybody. My name is Basiliso Moreno. I'm a licensed master's level social worker in the state of Delaware. Formerly, I was working as a school social worker down here in Delaware. Starting next month, I'll be working as a social worker at a HIV program at one of the main hospitals here in Delaware. I'm also a entrepreneur at Basiliso Entertainment is a holistic online self-care program for mental health professionals and social workers using poetry and virtual Zumba classes.
All right, thank you. And next, we'll have Isabel introduce herself.
Hello, my name is Isabel Villalobos Reynolds. I'm coming to you live from Dallas, Texas area. I am a licensed clinical social worker, and my primary role is I'm a director of behavioral health at a federally qualified health center or community health center called Mission East Dallas. I started the program about 3 years ago, and they chose me, I would say primarily because I speak Spanish. They absolutely had to have someone, and it was open, the job, for 6 months because they couldn't find anybody. And so the work that we do here just means so much because about 75% of the population is Latinx, and in Texas, we do not have good healthcare, and so we are it for those that are undocumented, or just are don't have enough insurance. And so I am a therapist there, and I also just run the program in general. And then I also have a part-time private practice where I do primarily see first generation folks.
Great, thank you. So today's first question for our panel is, for just opening the floor for each of you to kind of share what your personal connection with mental health is. What led you to this career path, if you're, a professional in the mental health field, and what work you're doing to support the Latinx community, which I know, some of you shared. So yeah, Hilda, you're welcome. Sorry. Isabel, you're welcome to go first.
Okay. So short story on a personal side, I live in Texas, but I grew up in the border town in California. And so my father was addicted to heroin my entire life. And so he wasn't really involved. And I sort of felt like I was an observer of, all the things that were going on around me. And as a child, didn't have a lot of control over those things. And so I figured, what else can I do to kind of help others not go through what I went through? But honestly, even what led my father into that, because he experienced trauma. So I kind of do it for me, but also for the generations behind and the generations to come. And so that's kind of what, on a personal side, what led me and what motivates me.
Thank you. Thank you for sharing that. All right. Bass, would you like to go next?
Yeah, I first started in the field in foster care, so I definitely saw a lot of mental health that was left untreated. Mothers trying to get their kids back that were taken into the system and having pretty much the system using their mental illness against them, and having the moms work extra hard to be mandated for services just to try to get their kids back. Many of the moms were successful in doing so. So that was really like my first taste in seeing how, at least in the workplace, seeing how systems working against the clients that we serve, and pretty much myself try to a brand new caseworker. Like I still wasn't even in grad school yet when I first started working in foster care and trying to like navigate the systems and trying to help my clients, if deemed appropriate, try to get their kids back. So now I see that in my community. I'm born and raised in the Bronx, and kind of, there's different pockets, still to this day in the Bronx that you see a lot of issues with mental health, a lot of addiction that's not being treated, and services unfortunately that's being cut from our state and local officials. So it's definitely out there, and we kind of have a difficult time in trying to navigate all the systems and try to help our clients and try to advocate for services and the need of services.
All right, thank you for sharing. And what about you, Hilda?
My journey started several years ago with a sibling that had severe depression due to another family situation that we lost a family member to suicide. And I wanted to help my sibling, but I didn't have the tools. So I started looking online, reviewing NAMI tools, educating my family to support this other family member. And in the process of trying to get support and through my travel as part of my day job, like I call it, I realized that it's a common thing. We don't talk about things, and then there's stigma that encourages not talking about things, combined with the fact that the education or the tools are not there in a common language in Spanish. So that's how I started, and now I took the training to be able to be an advocate, a resource, like Bas indicated, a vessel to provide that information and to connect with the resources available. To Isabel's point, I mean, there's a generation before us that maybe brought us here, but there's a generation ahead of us in the youth community that doesn't know. And we need to make sure that they know that it's okay to talk about it. It's okay to be at whichever stage you're in your life, and there are resources there to move you forward at your own pace.
All right, thank you. And Angela?
So yes, I was born in Puerto Rico, and I was raised in Rochester, New York, since the age of, I want to say like 4. My mom still doesn't speak English, and I'm 29 now, so it's been like 25 years already. Like, so I am fully bilingual. I'm one of the very few that is bilingual here. I would say, I don't know if like in the whole New York State, I would assume we're like very scarce because we're scarce everywhere. But here in Monroe County, I know that I could count very, very like a handful of actual peer advocates. As I mentioned, like peer advocacy is different from skill building because it goes directly to the person's meet them where they're at, and like age range. You have to be certified from until you're 31. Once you turn 31, then you age out to adult. So being a youth peer advocacy, like Hilda mentioned, like it's very important to reach our youth and break the stigma. So I started out basically, my mom suffering from her own, depression and stuff. And as Isabel, unfortunately, my father, like I grew up with my father being a heroin IV addict till this day. And it wasn't until I entered this mental health field that I started understanding more of his story and the childhood trauma that came before that led to what my parents are now, which then come and affect us, the kids and the other generations. And it's like a inheritance thing if it's not treated or talked about. And in my experience as a Puerto Rican, even being raised here in Rochester, we don't really talk about it. Like we just don't. It's called the loquero. And breaking the stigma has been difficult just because we don't have a lot of people, a lot of Spanish fully bilingual people interested in this field. Also, when I was in the juvenile system, when I was 14, just because I had a lollipop in my hair and, you know, stuff went down. But that taught me, like, in that year of me being in the juvenile system, it taught me what is having a support system. So having adults role modeling, you know, and being there in a positive way, because growing up prior to that, it was mainly like addicts or drug dealers or, you know, stuff like that. So I never even knew what it was, a support system. And then I joined SWAT Youth Council here in Monroe County, which led me to my art was used in the, like, nationally for the Federation of Families for Children's Mental Health poster for 2008. And at that moment I was like, why would I do something that's mental health? Like, because me having that stigma behind me, like, I'm like, but I still did it. And then years later, I went through my own, you know, experience with mental health, which led me to apply for where I work now, which is a small organization, Compere Rochester, which focuses on, like, mental wellness through friendship. So not, you know, meeting people where they're at, not up here, you're not down here, like, we're the same. We all have our stories. And speaking about it is, like, the first step in just always having hope. Yeah.
Thank you.
Thank
Thank you. Thank you all for sharing that. You know, seeing the different connections that we all have and, you know, in this conversation. So I am Puerto Rican as well. I grew up in the Bronx, like Bass. Now I live in the capital region now, and I moved up here to work at NAMI. And I shared earlier with the panelists that for me, we didn't talk about mental health in my house. And so it wasn't until I started college, and I'm first generation college as well, that I started taking psychology classes and then was able to name what I was experiencing since I was a teenager, which is anxiety and depression. And just because that wasn't spoken about, and there's still so many different conditions that, you know, needs more awareness. I'm a person who's living with PMDD, which is something that really affects your mental health, and it's not an easy diagnosis to have to live with, but it's one that I'm glad that I was able to figure out what was going on with myself, name it, and then get on a journey to get support. I'm also first generation therapy, which I'm always very proud to share with people. And I'm just like a big advocate for, like, people starting therapy, for people starting the meds that they need that could be life-changing and make your life a little bit easier. And so I openly share that I'm on antidepressants and anxiety medication, and I work with a lot of youth, and that's usually the questions they come to me with. What's that process? How does it look like? And that's something I really like bringing more awareness to, so that people can feel more comfortable with that process, because not everyone has someone to talk to about things like that. And I know when I talk to my white friends, right, and they maybe because their mom already went to therapy, or someone in their family is already talking about how they're on medication, they have someone to look to and ask them about, and I didn't have that guidance. So I'm really proud to be that guidance for other people as they're figuring out their mental health journey as well. And thinking about some of the other things that was mentioned, I have a family member who's in recovery for heroin usage as well, and they're in recovery, and really grateful for that, because I know from talking to other people who had to continue living with that dependency, how much it can affect the loved ones and themselves and their mental health as well. It's something that is prevalent in these different Latinx communities, and something that is affected by mental health. And right, and with the overdose pandemic that's going on as well, it's something that we really have to think about, bring more awareness to, and get people to the support they need. And as Angela was saying, right, meeting them where they're at, making sure that we're doing harm reduction, even if that's what we can do. So, thank you all for sharing all that. So many great different topics. Something many of you brought up was stigma. So, what's your perception of stigma in the Latinx community now in your specific community, maybe growing up with your family, and, what are ways that you do to like navigate that, and how in our work can we continue to find ways to end that stigma and share our experiences and educate others so they don't have to suffer alone.
I can tackle this. It's interesting because I feel like as I sort of take on my role very, very seriously, because as you mentioned, Cass, a lot of times the people that I see, I am it. All they see is me, a Latina who I almost feel like I have an obligation to share that I take medication, that I'm a therapist who has a therapist, because that is not normal for them. And I've seen how it transforms their lives when it's so normalized. On a personal end, up until probably maybe a year ago, my mom finally understood exactly what I did. Because she would say, do people really have that many problems? It's like, it's something that is just so foreign to her generation. And so I take that on. And you sort of have to. And then a lot of my younger clients will then go tell everybody, oh my gosh, you have to go to therapy. And then one of the things that I do in my private practice is I try to only see people of color, because there aren't many people, therapists of color. So I try my best to sort of give back in that way, but also sort of model that and say that it's okay. That honestly, I also say it's genetic, so we got it also too from our families. So it's not our fault. We're just doing the best that we can.
Yeah, it's also like we mentioned earlier, generational. Like you see, now myself, I'll be 43 this year, and my parents' generation definitely like what like counseling, like even like within like my dad, I've been trying to get him counseling for like 3 years now, and it's like he'll do an intake, is like, nope, I'm not interested. Like rather talk to me. I'm like, I can't be, yes, I'm in the field, but I can't be your therapist. It's not, it's not healthy, especially after the loss of my mom in 2020. I'm like, no, like we're grieving the same person. Like I can't, I'm grieving and you grieve your own way. And then he never has like any filters. So he's like talking about his parents and his situations. I'm like, I can't deal with it. Like that's what you need to talk to somebody. But that being said, even like some clients I had that they normalize, just crying every day. I'm like, and had to be frank with them. This is, it's not normal for you to be crying every day. Like what? Just yes, like you miss your family, like your daughter or whoever is not calling you like every day like you want them to. But crying every day, having crying spells, it's having depression. Yes, let's talk about it. Let's normalize that aspect of it, but let's not normalize for you to be crying every day. What are ways that we could do throughout the day that for yourself, that you don't have to have those thoughts that, or put those thoughts away, that you could do something productive instead of being at home and having these crying spells and things of that nature. So like at least my generation, like letting our older generation know, like, hey, like um it's okay not to be okay, and there's plenty of people to seek help. There need to be more of us, Latinx out there in the field to provide support. I've had jobs that it was a prerequisite for me to speak Spanish in order to get the job. So I'm also bilingual. Not even the job I'm gonna have next month. Like I had to basically be bilingual in order to have the job. So, so yeah, that being said, and then also like our generation to teach the younger generation, like, yes, like, so it can be okay to see a therapist, you take medication, okay, and educating them what the medication are for. And that's a big piece as well, and normalize the different medications, was out there, what's available, and it starts at the local level too, to educate our politicians about, making sure we have enough youth programs for kids, and things of that nature.
Great. Hilda, Angela, do you have anything to add?
I do. I am a lay person, so for me, having tools to be able to travel in my own journey and be of support to my family members, it's what motivated me to help others. But as it regards to the stigma, let's face it. I mean, we stigmatize each other within our own Hispanic community. We are stigmatized by other communities. And for me, I'm very observant. And sometimes, an example, somebody might be grieving, and it might not be necessarily a reflection on tears. It will be anger. It will be wishing to end their journey because they cannot cope. So I'm more focused on that as it relates to my community, and to be able to engage at a bigger level. The point being, okay, so we make fun of each other, but we have so many commonalities. Let's start there, so you can go down and, like Angela said, meet them at their level, and then go into the broader spectrum and be able to support and showcase us as a reflection by building the advocacy and the support with the tools that we have. If that makes sense.
Thank you. Angela, did you want to add anything?
I would say it's just like understanding that we all have some type of stigma and bias, and just accepting it, trying to like change the way you perceive things. No one is judging you. We all have our own journey. We have to have self-care. We have to take care of ourselves before we take care of our participants. And when it comes down to stigma, I would say it's out there big, like it's getting talked about now. And good thing is that I guess people are becoming more aware. And that's why we have like an influx of participants, clients, waiting lists when it comes down to these services now. Now it's just a matter of people being like, how do I put it? I'm sorry. Like willing to do the work, like to actually do the self-care and take care of themselves in order to actually sit and listen to other people and help them. When it comes down to the YPA, I always went to the YPA. We go out to their homes, like we go out to the community. We show them that we are human as well. And that the stigma is okay. Like it's okay to be talked about. Like we all know we have the stigma, and like right now we're trying our best to do the work, but we have to like meet each other halfway and accept that that's what we have to work on. Does that make sense? Yeah.
Oh, no, that makes total sense. And I'll share, I know when I started considering going on medication, and I told my mom, she was like, oh, you don't need medication. You need to pray. You need to pray. You got to ask God to help you. And that's what I do. And I'm like, you're not really the best example of the most mentally healthy person. But after I started doing that, and it was clear that it was helping me, and I was doing a lot better, and my mood was a lot better, I think it really changed her opinion on that. And, thinking like it's not something that's wrong with you, but why not take something that's gonna make things a little bit easier, and like you said, like you shouldn't be crying every day. You don't have to suffer, right? There's different things, and therapy is one of those things, right? It doesn't have to be medication. but for me and my mental health, I need both. I need, I see my therapist weekly, I take my meds daily, and it works for me. And I, like to talk about it because, especially with people in my family and who are part of my community, and because it's not talked about enough, you bring it up and they look at you like, oh, like, you're sharing a lot right now, like you're being really vulnerable. And to me, it's like, no, this is just my normal, this is just me talking about normal things, and I'm going to make it normal for you to hear about them until it becomes normal enough for you to talk about it wherever you go to. And that's how I live and put it into my like daily practice of trying to end the stigma. And I think that, that's something that's easy that all of us could start doing slowly. And I think that can make a real difference, because once, like someone else said, right, model that, right? Show that you can talk about it, they can talk about it, and it'll surprise you how people pick up on that, and they'll start changing the way they talk about things. I think, I've seen that in little places with different people in my family, and it's always nice to see. So now we'll move on to our next question. Unless you go ahead.
Yeah, I was gonna add, like, one thing that people have like wrong is that they think when it comes down to mental health, it's a lifelong time forever thing. Like it's like getting the information out there. Like sometimes people are just in a crisis, like they just need help at that moment. Like some other people need like see their therapist every week or some monthly. Like it's just when at the moment how you're feeling, and let them know that it's not a forever thing. Like you don't have to be known by your diagnosis or by what you went through. It's just knowing that help is out there, and go get it because it's gonna help. Like that's the whole point of getting help. Like so that's when it comes down to stigma, I just think about that because I think that it's like a lifelong, forever, something's wrong with me thing. When that's not the case.
Yeah, and that you bring up a great point too, right? Like therapy, you don't have to have a mental illness. You don't have to be in crisis to go to it. And if you are in crisis and you never have been before, and maybe you never experienced depression or anxiety before, like it's like it happens and it's okay. And there's places and resources that can connect you. And, we as a society have to be, keep working to create spaces where we can have these real conversations so that we can better support each other. So thank you for definitely bringing that up. So the next one is, how does language play a role? Many of you mentioned being bilingual. I know that Angela has done work advocating for getting more virtual services, especially during the pandemic. So I'm curious to hear like what people have noticed, or some of the things that are definitely needed, and what has evolved, what has been worked on that you noticed that's better for people who face language barriers in getting access to care. And I see that someone raised their hand. Jasmine, if you can put your question into the chat, I'd be happy to, share it with the panel. But yeah, anyone is welcome to, start with that question about what your work specifically does to help communities whose first language isn't English.
I personally don't see much change. In fact, the need has been enhanced, multiplied, tripled, quadrupled after COVID and through COVID. And that's one of my focus. I want to make sure that the resources that are out there, and I know things are changing slowly, but as I said, the needs have multiplied because of this world state. And with that, I'm just trying to be able to provide resources as I read, as I know that the different organizations provide for our communities to participate and be aware that they are out there. We're making great strides into translation processes at different organizational levels, but we're way behind, I believe, my personal opinion.
Yeah, I agree with that. We are still behind to a point like using like language lines or phone calls when we have like school system like IEP meetings or just any sort of like documentation that needs to be filled out, like any recertifications, even interpreters like in the courts and waiting around just for an interpreter. So you are in court literally all day to hear their cases, just waiting for an interpreter. I've experienced that when I was working at the school system last year, over a year ago, and seeing like my Spanish speaking families, yeah, they'll get documents in Spanish, but then I learned that they couldn't read or write in Spanish, so I literally had to do extra home visits in the community just to explain what the school district is doing for their kids, and the kids went to virtual and setting up Zoom links and passwords and teaching them how to use Zoom, and whether it be class today or like this is the class schedule, and everything that related to the schools, or giving free lunch for families. I literally had to do home visits just to explain all that, just because of the huge language barrier. And the district I worked at didn't have anything else to provide the families. Like, hey, we're giving the information in Spanish, but didn't realize or fully understand that many of the families that we were serving couldn't read or write in Spanish.
I want to say that I do think that in this way, because I do work in healthcare, I think that in general, healthcare does a good job with having things in English and Spanish. At the clinic that I work, it is actually a requirement that the staff mirror the community. So most of us speak Spanish. So that isn't the issue. I think there's a cultural component though, because there was a patient who Bass reminded me, there was a patient who couldn't read or write. She had been going to our clinic for primary care for years, but when she got to me, they kept saying that she was having suicidal ideation, and when I would talk to her, that wasn't at all the issue. Well, come to find out, it was because she was she was answering the screener and didn't know what it was saying, but she didn't feel comfortable telling them until she met me. And I had to put like this thing in her chart to say, like, she can't read or write. You can't have her sign this. You can't have her, do this. And so I think that there's also a cultural aspect in making sure that they also feel comfortable kind of sharing their concerns.
As for where I work at, like you guys mentioned, it is like slow, the transition when it comes down to like even the translation. Like, I am the only Hispanic, the Spanish speaking person at Compere Rochester. I took on a little bit of the translating for the different programs. And I was part of their cultural responsibility committee, which we had read in the documents that I guess we were supposed to translate. We were supposed to already have translated these documents to a second grade level. And this is just in general, because we find out that we use these big old words and people sometimes can't understand them. So we have to, like I said, like I have mentioned a lot of before, we have to meet them where they're at. But when it comes down to actually getting things done, it's like stalled. Like I did what I did, and I don't think anything's been done more than that. We have a waiting line for bilingual services in Monroe County. I think the only other agency we have is like Ibero, but people are getting referrals to mental health. I think we're the only mental health specifically, because there's like the juvenile one, like and the school one and stuff like that. But when it comes down to mental health, like, it's just me, the only Spanish speaking person, and it's hard to recruit any other Spanish speaking. But yeah, like the translation and documentation is just very slow, and we have to make sure we meet people where they're at. And what is it called? Give them a safe space, like Isabel said, like for them to actually speak out if they don't understand something, let it be in Spanish or in English, because some people, like especially like the elder community, in regards to like my grandma or my uncle, like my mom, they got pulled out from school very young, because so many siblings, or they have to take care of the household, and this is back in like 60s, 50s. So we have to have that in mind, for all our community. Yeah.
Sorry about that. I was trying to find the mute button. Yeah, thank you all for sharing that. I'm thinking about what we're doing right now, to address things like this. Like right now at NAMI, we have all these brochures, and our helpline and community coordinator, she worked with one of our volunteers who made sure that she translated all of our brochures. But you bring up a great point, and I know people who can't read or write in Spanish too. So what are we doing in that case? How can we provide something that could read it to them, right? Because I'm sure if it's read to them. And then also thinking about like what you were saying, Angela, with the words that are being used, right? These medical words that are being used that maybe people never heard because they never talked about mental health or how to hear those words before. So, making sure that the concepts are explained more too, and like making sure that we're realizing like what's the information that's needed and that it is different, right? Like having the same brochure isn't covering equity, right? We need to, like you said, meet people where they are, making sure that we have resources that will actually help people, right? Not just maybe like, oh, we did it, we checked the box, we made that, like cool, like putting the work into that. Were you gonna add something? Sorry.
So I had it on me. My daughter just came in from the pool.
Okay. And so I don't know if I mentioned this earlier because I know I share this with the panel, but we have a multicultural committee that we recently changed to the DEI committee, so diversity, equity, and inclusion. And what our mission is as a committee, right, is thinking about how we can take our DEI policy and make it more of a practice, right? So it's not something that's just on our website, right? Just not just checking that box saying it's there, we did it, but facilitating conversations with our affiliates and seeing what they're doing at their level to make sure they're promoting DEI and what's needed and how we can come together and like fill whatever gaps exist right now. One thing that was brought up from our Rockland affiliate was that they have a large Haitian community. And so what are we doing to get things translated in Creole, which, right, there's plenty of people throughout New York State, especially in New York City, who could really benefit from having things translated in that language as well. There's so many different communities. Our state is very diverse. So thinking about, how do we work to bring more cultural competency? And I saw that in the chat, someone was saying, how can you find a therapist who identifies like you? How do you find support from someone I'm trying to find the exact question, but if anyone has any specific recommendations, I'll say that you can go to Psych Today and you can check off certain boxes for what kind of provider you're looking for. It does have options for things like that. You can pick gender, you can pick race, you can pick sexuality, I believe, as well. So if anyone else has any tips on that.
Yeah, I would say the biggest, most popular way is Psychology Today, because most therapists are on there. How they find me is that a lot of times what they'll do is they'll put Spanish speaking, even though they don't need a Spanish speaking therapist. It's just kind of implying culture. And then I just make sure that the way that I have my profile, that I make sure that I identify that I am, first generation. And so, yeah, it's going through that. I also get people from insurances as well, who say their insurance gave them a list, and I think they ask for Spanish speaking therapist. And then also, I just want to remind people that you can see a therapist anywhere in the state. You do not have to see them nearby. I can see, being licensed in Texas, I can see someone in El Paso. So if you, with telehealth. So when we're licensed in the state, we can see everyone. So I always tell people, look beyond your area, go beyond that. And then because there's a lot of people that are going through training, internships, there are lower cost counseling available through the trainees. And so you just sort of have to dig a little deeper.
Great, thank you. Does anyone else have anything to add? So I'll also say that at NAMI, we do have our different programs, some of our different programs and classes in Spanish. So NAMI New York City is actually holding our basics class in Spanish coming up soon. So, and our basics program is, educating people on mental health in general. And so that's one of the first classes, right? Then we have family to family, which Hilda mentioned earlier, right? And she's looking to get that into Spanish. And we have our Sharing Hope program. And we also, so that is specifically for the African American and for the Black community. And then there's another version that is in Spanish, and it's for the Latinx and Hispanic community. And so with these new initiatives from NAMI National, it's about creating spaces for people to share, creating dialogue within those different communities for people to share what resources they have found, what are the mental health issues and needs in their community, and figure out together how to address them, and getting advice from others for, when it comes with families, how did, this family support whatever loved one is living with a mental health condition, how are they supporting themselves? And the same goes for peers. And so there's also some of our affiliates do have support groups that, have people who speak Spanish as well. So that's something we're looking forward to see more. And right now I know that the NAMI NYC that I mentioned earlier is getting everything translated into Spanish now, and we're looking to follow in their steps so that we can have our programs and our different Zooms with the community translated into Spanish as well. So we were trying to have the option today for closed captioning as a start, which is something we're still navigating, but I figured, it's better to start somewhere. And so we do have on our website information for different communities as well. It lists the areas, it lists tips for, finding culturally and linguistically competent care as well, questions, to consider when and ask mental health professionals. Usually when you are setting up a appointment, they will ask you different questions, and you can ask questions right back. Make sure that this is the kind of care that you're comfortable with, that you feel safe in sharing and disclosing information about, right? Make sure you ask them what experience do they have in addressing Latinx needs, right? Have they ever had clients before? Have they received any training? Just ask the questions that you need the answers to feel safe and cared for, because your support and your care matters, and you have a say in that and how it looks. Hopefully that made sense. All right, so does anyone have anything to add? Because I would like to open up the floor in case anyone had any other questions.
I would say I wanted to add like the youth peer advocacy that's on now. It's been on for less than 10 years, like, so we're pretty new. I would like to see hopefully in the future that we be taken a little bit more seriously, especially like our professional ones. I see a lot of you have degrees. Yeah, I went to college, but when it comes down to personal and lived experience, that's what we're all about. So to get credentialed in that area, like sometimes people don't go to college or don't finish high school, but we connect more with the youth on a personal basis because we have that personal experience. So hopefully moving forward, like especially maybe us credentialed as professionals, we could be considered a little bit more serious than just we don't have that much experience because we didn't go to college. Because people, youth look for people, for other peers that know, that could relate, and that's what we tend to do.
Yeah, thank you for bringing that up. At NAMI, we know that lived experience is the most valuable, when it comes to any of our work, right? Any of our advocacy. It's the stories of people who have experienced these things that really inspire and move people for change. So, whatever we can do. And, you also bring up, when I started college, I had dropped out originally, and it took me a while to go back to school because of my mental health conditions and navigating through that. And there's many people who experience the same things, and many people in our communities who maybe don't have support from people at home, and it's really stressful going to college and navigating that on your own, and it's a culture shock, and there's so many different things that you're dealing with that you weren't prepared for, and no one could prepare you for because they didn't experience it themselves. And so making sure that we're reaching out to youth and helping their development and making sure that they get what they need and that they feel like they are set up for success, and anything they do is really important. So thank you, Angela, for bringing that up for sure. Does anyone else have anything else they'd like to add?
You mentioned earlier about the Haitian Creole. That's definitely a huge population that definitely needs resources and supports and proper translation. I work with a family here in Delaware, Haitian Creole, and using that language line, yeah, it helped, but instead of having better use of the translation, would have made a 15, 20-minute meeting end up being 45 minutes to an hour, just because of those type of services that's not there. And myself would be working in Southern Delaware, where there's a lot of a huge population of Haitians in that community down there. So it'd be interesting to see resources or possibly lack of resources for that community.
All right, and I'm going to stick in the chat our NAMI-NYC's link for what they have available in Spanish. So if you're looking for any resources, you can check that out. And you're always welcome to reach out to them to learn more about their programs. And because things are virtual, you can attend any of that online as well. So those are great resources to have and to meet other people and talk about what they're doing, learn from what they're doing to find out how to better support your community. And we'll have some updates soon about what we're doing to keep increasing our work and our work for DEI and to raise BIPOC mental health awareness. So does anyone out there have any questions before we close today's program? I'm gonna just check the chat, see if I missed anything. Lingual. Okay, we got that one. Right, oh, looks like there's something. All right. Well, thank you all. And you are all welcome to email me at cassandra@NAMI-NYS.org if you'd like to learn any more information. This program has been recorded. It will be in tomorrow's e-newsletter that we send out weekly. You can check that out on our website as well and sign up to join our mailing list. Thank you all for joining us. Thank you so much to all of our panel for sharing everything that you did, your personal experiences, the work that you have. Everything is just so valuable. And we hope to keep building on this conversation and this work together. So thank you all. And if you have anything else to add, you're welcome to. I think we have one last minute.
I just want to say thank you for allowing me in as a Mexican American from California that lives in Texas. Not the favorites of New York as far as being in Texas. And so it's been an amazing experience. If anybody needs anything from me, I would love to help, anyone. So
Awesome. Thank you.
Yeah, thank you to NAMI. Thank you, Kaz, for the opportunity. Dr. LaShawn Paul for setting this up for me. Two things real quick. I'm also a licensed Zumba instructor, so I'm hosting a Zumba event July 30th, 12 p.m. Eastern time. It's $10 a person. Proceeds will go to the Planned Parenthood of Delaware. So by all means, tune in and have some fun, practice some self-care. And my book, Triumph Through Pain, How to Maximize Your Full Potential During Hard Times, is out on Amazon. I literally just got the author copies today, so I'm very excited. So by all means, Moreno.com, or you can go to Amazon, purchase the book. Thank you for the opportunity.
All right. Thank you. Thank you all. Looking forward to seeing you all again soon. I know Hilda will be on meetings together soon again. All right. Well, take care, everyone. Do some self-care today. Maybe watch your favorite show, listen to your favorite song, rest, drink some water if you haven't, right? And take care. Thank you all for joining us. And again, you'll be able to watch this recording soon. Have a good night.
Thank you, everyone.